usually diabetic patients are more prone to urological
Absolutely,
disorders.
correct.
So what kind of precautions they must take, and how regularly they must do their urinary infection tests and everything?
Diabetic patients will have two problems pertaining to the kidney. One is diabetic kidney disease. This is one. And secondly, diabetes patients are likely to have more urological problems. In the sense they very easily develop urinary tract infection. It can become very severe anytime. Secondly, they also develop, because of the nerve damage, because of the neuropathy, they can develop diabetic neuropathy. So they are also prone to get prostate enlargement. They are also prone to get more kidney stone formation. So it is very important that diabetic patient must do a very, very regular checkup. They must, as usual, they must be doing urine examination, blood sugar control, lipid, fat and all those things. And most important thing is the control of the weight. And more important is the control of the diet, which is most important, and a regular and very, very healthy lifestyle. And this is the way one can defeat the diabetes. You cannot defeat the diabetes only with the help of medicines. Medicine will play some role, but much more thing has to be done for any diabetic patients. If you ask me what are the tests, general urine routine tests, sonography, if required more sophisticated tests like IBP, CT scan may be required, but at least a sonography and urine examination are a primary and basic test to know what's happening with the diabetes.
Okay. So doctor, basically they say like eating a lot of sugary products or sugar that we consume through desserts and all these things, that also has a huge impact on bladder and urination. So if you can help us.
Since you talk about the sugar, yes, definitely excess sugar. Rather, sugar itself is not a very good food type, I would say. Sugar itself has a lot of acidic residues in the body, and those who are prone or genetically prone for getting diabetes will likely to develop diabetes much faster than a normal population. It will also add to the calorie and also help to increase weight and to become an obese person. So ultimately, sugar is one of the major factor to be observed, to be avoided in the diet. If you can supplement with jaggery, supposed to is like a sweet, another sweet, traditional Indian sweet jaggery or gur, what we call it as. It is still better. I would definitely recommend if somebody can replace the sugar with this, and obviously must reduce the excess intake, or rather very low intake one must take of the sugar.